everyone, I'm Missy, and I'm going to be presenting the research that I did as part of my senior thesis with the help of my advisor, Dr. Radovich. So imagine this. You're a 20-year-old daughter of a single mother, and you have two younger sisters. One day your mother unexpectedly dies of a pulmonary embolism, leaving you with only $300 to your name and the custody of your two younger sisters. Without any sufficient funds, you can't afford a burial for your mother and instead must have the state pay for a cremation. And you end up losing your childhood home because you can't afford the mortgage payments. This was a sad reality for Brittany Lacombe, pictured here. And it could have been avoided if her mother had been the owner of a life insurance policy. So over the past 50 years, there's been a scary trend of a decline in life insurance policy ownership in the United States, and that is leaving families financially vulnerable in the event of an unexpected death. And this is especially true for the American middle market. The American middle market is a subset of American families who's largely underinsured. These families, or the heads of households, range in age from 25 to 65, and their household income is between $35,000 and $125,000 annually. Of this group, 73% believe that life insurance is indeed a necessity, yet only 10% intend to seek the help of a financial advisor, likely due to the cost sensitivity of this group. Even more, 33% rely solely on the group coverage provided by their employer, when in most cases this isn't sufficient. So the goal of my research was to see if there was a difference between the life insurance recommended advice that you could get by turning to the internet as opposed to going and seeing a financial advisor. So to do this, I designed 3 case studies featuring a family of 5 living in the state of Virginia. In my first case study, the wife was a stay-at-home mom and the husband was the only one working. In the second case, both the husband and the wife worked, but the husband was the primary breadwinner of the family. And in the third case, it was similar to the second case with the addition of a dependent parent living in the home and rental properties which generated additional income. These cases also varied on the amount of retirement savings, investment strategies, liabilities, and bequests. So using the information in my case studies, I inputted the family's financial scenarios into a sample of 23 online calculators sponsored by the organizations listed in the first column of my chart. I also classified these organizations as either being a life insurance company, meaning that they sell their own insurance products, or being other, meaning that they are a consumer or consolidator organization. And lastly, I recorded the number of inputs requested by each calculator. To compare this to the advice given by a financial professional, I also designed a survey which consisted of a few background questions followed by the same 3 case studies. And each respondent was asked to recommend additional amounts of life insurance coverage needed by both the husband and the wife in each case. And I sent this survey to members of 4 different financial associations which are listed on the slides. And since my case studies were set in Virginia, I tried to limit my sample to advisors living and working in the state of Virginia. So pictured here on this graph are the results that I received of insurance recommendations for the husband in cases 1 through 3 based on the online calculators. It's a little small, but on the bottom is listed each of the calculators, and then there's a bar for the recommendations for each case. And as you can see, there's a large amount of variability in the advice given between calculators, with some recommending amounts as low as $500,000 and others recommending amounts close to $2.5 million. This is a similar chart showing the results for the wife in each of the 3 cases. And again, there's a lot of variation between each calculator. Some recommended amounts lower than $200,000 and others recommended amounts close to $1.8 million. So based on this data that I collected, I conducted 2 different statistical tests. The first test that I considered were t-tests to test my null hypothesis that the average amount of insurance recommended by life insurance companies was the same as the average amount of insurance recommended by other companies. And my expectations were that life insurance companies would tend to recommend higher amounts of coverage due to their direct tie to the profits of selling these products. However, in my test, this proved not to be the case, and there was no significant difference between the average amounts recommended between the 2 groups. The second test that I considered were F-tests to test my hypothesis that the variance of advice given by by calculators which asked for more than 13 inputs was the same as the variance of advice given by calculators which asked for less than or 13 inputs. This test proved to be significant at a 95% confidence level, which leads me to conclude that calculators requesting a higher number of inputs results in a higher variability in advice. So I'm now going to talk about the advice that I received from financial professionals working in the field. So unfortunately, my survey response was pretty low. I ended up only receiving 3 responses, but I did have representation from 3 of the 4 groups that I surveyed: CFP, NAPFA, and NAIFA. Each of the 3 respondents have been providing advice for more than 10 years, but only one specialized specifically in insurance. There was also an equal representation of fee structures used by the advisors: fee only, commission only, and both fee and commission. And as you can see in this chart at the bottom, it summarizes the results that I received from those advisors. And in the last row, there's also a large amount of variation in these advices, with the ranges between the highest and lowest amounts recommended between 2 to 3 million, depending on the case. Also, in general, the advisors tended to recommend higher amounts of insurance than the online calculators. So, some observations. Both channels, live and online, were characterized by large amounts of variability, yet the ranges between the live and the web advice were similar. So this supports the idea that optimal amounts of insurance are subject to personal discretion, and it varies person to person. Additionally, FinAid was the only calculator to actually recommend a range of insurance advice instead of a single value. However, the range that they recommended was a greater than $500,000 interval. So in conclusion, based on my research, online advice seems to be a reasonable substitute for live advice based solely on the numbers. Yet an individual turning to the internet for advice is forfeiting professional consultation that could be received by going and speaking face-to-face with a financial advisor. That being said, by testing a few different online calculators, an individual should be able to come up with a sensible range of insurance needed for his or her own situation. And from there, they could choose their own personalized needs based on their risk preferences. For the insurance industry, measures should be taken to improve the transparency of these online calculators, since there's such a great group that could benefit from their use. I would recommend that the calculators give their recommendations as ranges instead of single values, so that again it can be personalized by each individual, and the recommendations should be followed by explanations of the results and how an individual can choose their optimal amount based on their own risk preferences. Are there any questions? Yes?
You mentioned in your paper that you found it really surprising that very few researchers had looked at the online calculators, and that because there's such a large market. And from the chart, I noticed that there are companies such as Nationwide and John Hancock with very few inputs for their online calculators. Did you find that surprising and concerning that those kind of credible life insurance companies only had few inputs? Where do you think that comes from?
So there's different ways that you can calculate insurance needs. There's 3 that are mainly used, and one of the 3 methods is based solely on the income. So in that method, you would take an income and multiply it by a number between 5 and 10, and that's what you would recommend as your insurance. So there's methods as simple as that, and there's others that are more complex, trying to look at the present value of your needs and your assets and trying to calculate those things and come up with an amount from them. So I wasn't really surprised to see that some calculators didn't ask for many inputs. But again, I think there are ways that these calculators could be improved, and I think those ones could be improved to ask for greater inputs to consider more variables. Yes?
Were you able to tell what calculators were the most popular, or I was just wondering if people were partial to calculators with less inputs because maybe they're looking for convenience there?
I actually had no way of looking at that just based on the websites, but that would be interesting if you could see. Are there any final questions? Yes?
Is there a particular reason you choose t-test to test for testing the equality of means?
Yes, since I didn't have a very large sample of online calculators, I thought a t-test would be best fitting, since the sample again was a little smaller.
So how large is the sample?
So of my calculators, I had 23 of them, but when I divided them into groups, there was between 10 and 15 between the 2 groups I was testing. Thank you very much.